Here come the chiropractors from Utah defending Utah's ability to not put fluoride in the water because they think fluoride is poison. They say that 98% of the world doesn't use fluoride in their wells. I don't know where they get that figure. They say most of the world doesn't have dental insurance, which is probably true, but has nothing to do with this simple fact. The most common chronic disease in children is tooth decay. That's the most chronic problem. Cavities, the needing for dental procedures, that is a problem, and it's an expensive problem, especially if you're here in the United States. Number two, that is not epidemiology saying the world doesn't do this and the world doesn't have this problem. What epidemiology is like, here's a study like this one showing that decreasing cavities happens when you increase fluoridation in the water. Or this one from Britain saying the more fluoride we put in the water, the less cavities they have. Or this one in Denmark showing that fluoridation in water decreases dental procedures. Yeah, chronic problems with kids around their mouth. Let me give you another little statistic. Do you know why our ancient ancestors died? Mostly they had tooth problems because they didn't brush their teeth, and some areas didn't have fluoride in their water naturally where a lot of places do. And here is the problem that these same chiropractors have. They have no studies where they can show you the efficacy and the toxicity of the supplements they sell you, but they will sell them to you anyway. How do you know? They don't have the peer-reviewed studies. You won't find it on their places. It's just, oh, I have this anecdotal evidence, this works, and I make a lot of money selling you supplements. Fluoride in the water is cheap. Dental procedures are expensive. Supplements that they sell you are neither cheap, nor are they tested, nor do you know what the toxicity level is. So before you go talking about things you don't understand, maybe learn about efficacy and toxicity in those supplements you sell, because we know from a lot of great world literature that fluoride helps teeth. Yes, there's a toxicity level. There's also a toxicity level of aspirin, but that doesn't mean we don't give aspirin. But what about your supplements? You don't really know that, do you?